Moving into Chapter 10 now, we're going to focus more on chemical drugs that patients take to help fight microbial infections. And so for our first video lecture, we're going to talk about some of the basic principles of antimicrobial therapy. So we got some more terminology here to go over. So of course, drugs, this term drug refers to chemicals that affect physiology, so the function of living things. So those drugs could affect human physiology. Many drugs that we take do that. But in this chapter, we're mainly, since this is a microbiology class, we're going to be focusing in on chemical drugs that affect microbial physiology. And of course, the goal is to kill them and get rid of them from our bodies. And now later, when we get into chapters 12 and 13, we're going to learn about the immune system. So the immune system is miraculous. It does a very good job of eliminating almost every microorganism that invades our bodies. Pathogens, though, and we'll learn more about this in chapter 11, pathogens are capable of evading the immune system. The reason that they're so successful at causing disease is because they have ways of escaping from the immune system, at least temporarily, so that they can establish themselves and grow in our bodies. So think about these antimicrobial drugs as chemical substances that work in addition to your immune system to help clear these organisms out of the body that are causing us problems. So a chemotherapeutic is another term for any chemical drug that's used for treatment or relief. Now I know when you think about chemotherapy, if you say a patient's on chemotherapy, they're receiving treatment for cancer, but really any type of chemical drug that is used can be classified as a chemotherapeutic if it's being used to improve your health in some way. Treatment, relief, or prophylaxis. Anybody know what prophylaxis means? If you take a drug as a prophylactic, you're trying to take that as a preventative. Now this is not a vaccine. Yes, vaccines are prophylactics as well because they're going to help prevent infections, but vaccines work by stimulating your immune system to do a job. In this instance, we're thinking about chemical drugs that you would take, like let's say, people when they travel to parts of the world where there are lots of infectious diseases that we don't get exposed to over here, like malaria. You have a friend right now who's over in Zambia in Africa, and she had to take prophylactic drugs to try to prevent malaria. So if she does get exposed to malaria while she's over there, she's already on the medications that are going to go ahead and knock down the malaria protozoans before they can establish themselves in her body. So sometimes we take drugs as prophylactics as well. Or you know how sometimes if somebody in a household has the flu, they'll go ahead and prescribe other members of the household Tamiflu as a prophylactic to try. That way, if the other family members, when they get exposed to the flu virus, that drug can go ahead and knock down the virus before it can establish an infection. So that's prophylaxis. That means prevention. All right, so we're going to be focusing in on antimicrobial drugs or agents in this chapter. These are going to be chemicals that treat infectious disease. The scientist who is considered to be the founder of chemotherapy was a guy named Ehrlich, a chemist, and he had this idea, this hypothesis that there must be chemicals out there that would kill microbes that cause disease, but leave humans unharmed. And so that was his mission, was to go out and find as many of those as possible. And he did stumble on some pretty good ones that were effective against trypanosomes. You guys might remember Trypanosoma brucei from earlier in the semester causes African sleeping sickness, and then Trypanosoma cruzi I mentioned as a protozoan that you're going to likely hear about during your careers in healthcare because they cause Chagas's disease, which is an emerging type of infectious disease in our country. So he's found some drugs that worked against those organisms. Syphilis, Treponema pallidum is the causative agent of syphilis, a bacterial organism as well. All right, Alexander Fleming in the 1930s was the first person who discovered the antibacterial action of penicillin. So penicillin was really revolutionized medicine, and he stumbled upon this by accident, really. So he was working in a laboratory, had a petri dish with some old agar in it, or old culture medium. I don't know that it was an agar medium. And It's not unusual when you work in a micro laboratory and you've got these petri dishes with bacterial cultures on them, and you open the lids to take samples, and at some point a fungal spore in the air is going to land on that agar, and a lot of fungi grow really well at room temperature if you're storing these plates out at room temperature. So on older plates, it's not unusual to take a look at them and see a mold colony growing on there. So this is a colony of Penicillium chrysogenes mold on this petri dish. And we've got some bacteria streaked on here as well. And notice there's a clear zone around the mold. So that is a zone of inhibition. And so Alexander Fleming saw this on a plate in his laboratory, and he could have just thought, okay, well, that's interesting, and he might have just thrown the plate away. But instead he realized the fungus must be secreting some kind of chemical that's getting there into the agar and diffusing into the agar and preventing growth of the bacteria. And so sure enough, he was able to purify that chemical, and that's the chemical that we know today as penicillin. So penicillin is a chemical drug that is a natural product of Penicillium chrysogenes mold. In 1932, sulfanilamide was the first very practical antimicrobial drug. That's a type of antibacterial drug that's given as well. All right, so you may remember when we went over physical and chemical control methods, when we were thinking about instruments and surfaces and so forth, there were some characteristics of those types of things. And it's the same thing for antimicrobial drugs. So please read over this table in Chapter 10 of your textbook and have a good understanding of what some basic characteristics of an ideal antimicrobial drug would mean. Let me point out this: selectively toxic to the microbe but non-toxic to host cells. Again, this is ideal. So selectively toxic means toxic for the microbe, not toxic for your cells. That's ideal. Now the reality is most drugs have some level of toxicity for our cells as well. But what you're looking for is something that's very toxic for microbes and is going to kill them fairly easily. But leave your cells unharmed as long as you don't expose yourself to too high of a dose or take the drug for too long of a period of time. You want drugs that are microbicidal rather than microbistatic. They need to stay soluble, which means they need to be diluted in your body fluids. That's kind of important so that they'll diffuse throughout your body and go to the actual location in the body where the infection is taking place. You want to be sure that your drug doesn't get broken down or excreted from the body. You don't pee it out too quickly. You want to make sure your liver's good at breaking down chemicals that we get exposed to. So you want to make sure your liver doesn't process it and break it down too quickly. Does not lead to development of antimicrobial resistance. We'll talk more about that toward the end of the chapter. We've already talked about how these drugs are supposed to be complementing or assisting your natural immune system defenses. Needs to remain active in your tissues and body. So a lot of these body fluids, that's kind of common. Since readily delivered to the site of infection, it's got to get to the actual place. You swallow the pill, it's got to get to the place in the body where an infection is actually taking place. Reasonably priced. Again, we're thinking ideal. I know a lot of drugs, antimicrobial drugs, are not reasonably priced, but ideally they would be. A lot of those prices that get passed along to us as consumers because the expenses associated with developing a new antimicrobial drug that's going to be given to human patients and has to be shown to be safe and effective. There are tremendous costs associated with that, from research costs to safety studies to costs for attorneys who handle all of the legal aspects of bringing something like that to the marketplace. And then you don't want a drug to trigger allergies. And you don't want the drug predisposing you to other types of infections. We've already talked about some examples of that with C. diff, Clostridium difficile, which causes a horrible type of gastroenteritis, and or colitis more specifically in the colon, inflammation of the colon. And that tends to occur in patients who've taken a really strong antibacterial type drug that kills off a lot of the normal microbes that live along the lining of the colon and opens the door for Clostridium difficile to overgrow to very large numbers, and then it starts to damage the body. So all of those are some things that are ideal characteristics of an antimicrobial drug. All right, this is a good table too. Be sure you learn the terminology that you see here. We've already been over chemotherapeutic, prophylaxis, antimicrobial chemotherapy. An antimicrobial, that term is just a broad catch-all term for any drug that's used to treat microbial infections, regardless of where it came from. All right, how about this term antibiotic? Now, we hear about that all the time. These are true antibiotics, or substances that are actually naturally produced, like we just talked about how penicillin is made by penicillium molds. So it's a natural compound, naturally produced by other microorganisms that, lucky for us, winds up inhibiting or destroying different kinds of microorganisms. So penicillium molds secrete this chemical that kill a lot of bacteria. So that's a type of antibiotic. Antibiotics are naturally occurring drugs. Now, most of those are primarily effective against bacteria. So usually when you hear the term antibiotic, those are antibacterial drugs. So you don't take an antibiotic to treat a viral infection, for example. Viruses are very different from bacteria. You got to have completely different drugs to treat those types of infections. All right, synthetic drugs, that would be a drug that has been synthesized artificially in a chemical laboratory. So it's a man-made chemical. Now, in between these two, a semi-synthetic drug, that's where the chemists take a naturally occurring antibiotic chemical compound and they modify it. So they attach some other atoms and so forth to it to change it a little bit to try to improve some of its properties. And a lot of the antibacterial drugs that we take fall into that category. They're kind of like improved antibiotics. We've been over narrow spectrum and broad spectrum when we talked about disinfectants and control methods, when we talked about physical and chemical control methods in Chapter 9. Narrow spectrum antimicrobial drugs effective against a narrow range of microorganisms. Broad spectrum will be effective against a whole bunch of different types of microorganisms. Okay, here's a table from a previous textbook that we used, which is pretty good for just kind of giving you an overview of where some of these antibiotics come from. So these antibiotic drugs, those are the ones that are naturally produced by microorganisms. And here are some examples over here. So some of those are produced by fungi, but a lot of them are actually produced by bacterial species. So there are bacteria that produce these antibiotic chemicals that kill other types of bacteria or inhibit their growth. And many of those are in a genus Streptomyces. Those are soil bacteria that, lucky for us, produce a lot of these chemicals that we've been lucky enough to be able to use as antibacterial types of drugs. Why do fungi and bacteria make these? You would think maybe it's a competition type of thing. Secrete these chemicals so other microorganisms can't grow in your environment and steal your food. In reality, it's thought that may not be the case, and we don't really know what roles these chemicals play naturally for bacteria and fungi. Another important aspect with any type of drug that would be used, whether or not it's an antimicrobial or not, will be the route of administration. That's going to impact the concentration of that drug in your body fluids, how fast the concentration of the drug rises in your body fluids, and how long it lasts. So there are different routes of administration that can be used for drugs. These will vary for different drugs. So some types of drugs you have to use one particular route. Others you may have more than one route that can be used. So if an antimicrobial is being given topically, not tropically, but topically or locally, the drug is being applied to the skin or directly to the infection site. So that's common in some cases. Oral, of course, you swallow the pill, goes through your stomach, passes down into the intestinal tract, and that's where it's absorbed. So absorption occurs mostly in the small intestine. And if you do that, so this is a graph over here. The y-axis is showing the concentration of the drug in your blood and other body fluids versus time. So orally, you're going to see a change kind of like this. So you swallow the pill right here. It takes a while for the drug to actually be absorbed into the bloodstream through the wall of the small intestine. So there's going to be a delay before the level of that drug goes up. And then it starts to drop off as you're peeing the drug out, liver's breaking it down, and so forth. And then you got to swallow another pill so that you keep that drug present in your body fluids where it can fight infection. IM stands for intramuscular. That's where a drug is directly injected into a skeletal muscle, usually in the arm or the buttocks, the gluteus maximus muscle. And when a drug is injected that way, your skeletal muscles, as you guys learn in Biology 201, have lots of capillaries inside them. So the drug actually gets absorbed into the capillaries, and that's how it enters the bloodstream. So when you have an intramuscular injection, you don't have this delay like you do with oral administration. The concentration of the drug is going to jump up really high pretty quickly, and then it'll drop off gradually over time as you break down the drug and excrete it out of the body. IV stands for intravenous, and there you're being hooked up to an IV. You got a bag of fluids. The antimicrobial drug is in the bag of fluids, and it's just continuously being directly supplied into your bloodstream through that IV needle. So that's used in cases where you need immediately a higher concentration of the drug, and you're just keeping it at a constant, steady level. You don't want to have any of these fluctuations that you would get with oral or intramuscular injection of the drug. So if you're like really seriously ill and you've got to make sure there's a high dose of that drug in there, and you're keeping the concentration constant, that's probably going to be delivered through the IV method. Another little note here: when you guys study, when you guys take Biology 201, you study the central nervous system. You learn about the blood-brain barrier, how the blood vessels in the central nervous system tend not to allow as many compounds, molecules, to pass out of the bloodstream and into the tissues of the central nervous system as easily as occurs in other parts of the body. So that has to be kept in mind too with antimicrobial drugs. Some antimicrobial drugs don't pass across the blood-brain barrier very easily. All right, what things are going to impact your choice of an antimicrobial drug? Some of these we already went over, and some of these are just kind of common sense. Will it work against the infectious agent? Not all drugs work for all microorganisms. Is the drug going to be toxic for the patient? Obviously, you don't want to use a toxic drug. Unfortunately, with all this antimicrobial resistance that's developing and is in the news all the time, you could wind up in an unfortunate circumstance where you have a patient who is infected with some type of bacterial organism and it's resistant to almost every drug that could be used safely. So sometimes you have some bad choices, like this is the only drug we've got that could possibly stop your infection, but you're probably going to get damaged from it as well because it's toxic. Drug allergies, you always have to keep that in mind. People who have severe allergies to penicillin, for example. Drug interactions, they always ask you when they take your medical history, when you enter the hospital or you're at the doctor's office, what medications are you on? Are you allergic to anything? Because sometimes, drug A might work pretty well by itself, drug B might work pretty well by itself, but you put the two together and one of the two may not work anymore. So you can have drug interactions, or that can increase the toxicity. It can make them much less safe when you're taking those two at the same time. Risk-benefit ratio is always critical. What's the risk of taking the drug? What's the benefit? You want to make sure you have you want to make sure the benefit far outweighs the risk. So when we say over here, will the drug work against the infectious agent? Very often that winds up being tested in a clinical microbiology laboratory. You test to find out, all right, so you've got a patient who has, let's say, a urinary tract infection. So they provide a urine sample. You go into the microbiology laboratory, you isolate the organism, you purify it so that you can run tests on it. And one of those tests could be efficacy testing. Let's figure out what antimicrobial drug will actually kill this organism, because they don't all work the same on every organism. And so this picture that you're seeing here is kind of the traditional method for this testing. This is called a Kirby-Bauer disc diffusion test. And so you have the organism that is causing the infection in the patient. It has been spread out across an agar petri dish, and it creates a lawn of bacteria. And at the same time, you deposit little discs that have been soaked in different antimicrobial drugs. You incubate, and if the drug is inhibiting the organism, you'll have a clear zone. That's called a zone of inhibition around that disc. That's from the drug diffusing out of the disc and into the agar. Now, eventually, as that drug diffuses away from the disc, its concentration is going to drop down so low it's no longer going to be effective against the microbe. But then traditionally what was done is these zones were actually measured with a little metric ruler, and then compared to a chart to find out whether that zone of inhibition was wide enough for that drug to actually wind up being useful in a patient. Now, and like my wife does clinical microbiology at a urology clinic, and what they do in her office is they have little mini liquid cultures in a plastic plate that has lots of little miniature wells in it. You have bacteria in each of the wells, different drugs in each of the wells. You incubate, and then it goes on a scanner, and a computer scanner determines whether that little tiny liquid culture is cloudy or clear. If it's clear, that lets you know the drug kills that organism. If it's cloudy, it doesn't work. And so that information is then given to a physician who can choose what drug to prescribe to the patient. So these are called efficacy tests or sensitivity testing. Is the microbe sensitive to the particular drug? Another concept is minimum inhibitory concentration. This is another type of test that can be done. You can set up a series of liquid cultures in the laboratory with different concentrations of a drug, put the organism that's causing the infection, and find the tube with the least amount of drug that was still capable of preventing the growth of the organism. So that minimum concentration of drug that inhibits the growth of the organism is called the MIC, or the minimum inhibitory concentration. So ideally, you want a drug that's useful at a low concentration, because the lower the concentration, the less likely it is that that drug is going to wind up being toxic for the patient. So ideally, you want to use a drug that has a low, what we call an MIC, minimum inhibitory concentration. And those types of things can also be done now in miniature in these little plastic petri dishes with little tiny wells, and computer scanners can read these and make it a whole lot easier than it used to be. All right, so we've talked a lot about this selective toxicity. You want a drug to have a high toxicity for the microbe, low toxicity for the patient. So there's a measurement for that, and it's therapeutic index, or TI. So that's the ratio of drug concentration that is toxic for humans versus the drug concentration toxic for the microbe. Okay, so you want that number to be much, 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 much higher for the human than it is for the microbe. So let's say if you had a drug with a TI of 20, let's say, that means 20 times, the concentration would have to be 20 times higher to harm the human patient than what is needed to harm the microbe. So that's called the therapeutic index. The higher the number, the better. That's going to let you know that that drug is safer. Why do drugs not work? So why doesn't any antimicrobial drug work against any microorganism? Now, hopefully by this point in the course, that's not too surprising to you, because you've been learning throughout the entire semester about how diverse microorganisms are. But there are a number of reasons why drugs may not work may not be able to get into a body compartment, like we just talked about, how some drugs can't cross the blood-brain barrier. Resistance, this is always huge and an increasing problem. Microbes mutate and become resistant to these antimicrobial drugs that we use. That's a problem with bacteria, with viruses, with other types of microorganisms as well. In some cases, you may have a patient may be infected with more than one pathogen at the same time. And so if you just give them one drug, that might kill maybe one organism, but not the other. Biofilms, we're increasingly understanding how biofilms cause problems with drug treatment. If your microbes are buried inside a microfilm, covered up with all those nasty, sticky biofilm substances, then drugs can't diffuse through those biofilms to harm the organism. And then drug interactions as well, like we just talked about. That can cause problems too. All right, so that's kind of getting us started with antimicrobial drugs. For the next video lecture, we're going to start talking about some more specific types of antimicrobial drugs and how they actually work. What's the mode of action? How do they actually kill the microbes that we're trying to get rid of?